So your dog had a TPLO surgery in the past, but now they're starting to show some stiffness and other signs and symptoms that may be concerning to you. Well, today we're going to go through 5 different signs and symptoms that you can look for at home to see if your dog is still functioning well or not. I'm Adam, this is Bo, let's get into it. TPLO surgery is for when dogs have cruciate ligament tears and there's a lot of instability in their knee, or aka their stifle joint. You might hear me use that interchangeably. As a result, the surgery is done to correct that stability and create stability around the joint so it doesn't cause further injury. However, with any surgery, let alone something where they're doing an osteotomy and changing the structure of the joint, the function is always something that is going to change after a surgery. So it doesn't matter if it's a human or for four-legged friends here. Now, the knee joint is so important because the back end of a dog, we get a lot of drive and a lot of power out of that back end, or they do, sorry, and as a result, they need to put a lot of strain through there. So young dogs can get cruciate ligament tears, old dogs can get it. However, if it happens in a younger dog, typically as they age, they'll have some signs and symptoms after the surgery where their function is reducing. So let's look into 5 different things that you can be watching out for at home with your dog to make sure they're still functioning well. So number 1, everything is connected in the body. It's not like you can have a surgery on the knee and not affect the other joints and structures around it. So a really broad symptom that you can be looking at is their posture, more specifically their top line. So when they're standing, for certain breeds, there's different top lines they should have. However, if they are arched or roached, so they're rounded through the mid-back, that's typically what they do when they're trying to protect the hind end when there's weakness. So take a look at that. If you're unsure about what a top line is, I'll link a video up above that you can click on and it will discuss that in more detail. The second sign you should be looking out for is if your dog is struggling to derive power from their hind end. And what that may look like on a day-to-day basis is they're struggling to either go upstairs or into the back of the car or onto a piece of furniture. And if this is something they always did and now they're hesitant to do it, typically they're scared to do it because there's either pain or they literally can't do it because the function isn't there. And they might sit there and whine for you to help them up, or they'll just stare at you like they've never done it before, and it'll make you scratch your head and wonder why. So look out for that, especially if your dog was always capable of doing it. The third symptom you can look for is just generalized stiffness in the back end. So normally a dog should be very fluid. You should watch them pick up their knee joint and then place their paw down. You may notice with dogs like this that definitely are getting reduced function and range of motion in through their back end because of this TPLO surgery, is that they start getting really stiff. And a dog that's really stiff, they start waddling. So their back end moves as a unit rather than individual joints working to have that fluidity of motion. So keep an eye out for that. Their knee joint may also not really move well. So if it's really stiff and they're throwing it around, that's another thing to look out for. The last 2 signs and symptoms you can look for have to do with when your dog sits. So when they're dropping into a sit, what they should be typically doing is dropping down symmetrically with both legs and sitting back onto their hind end. I find when a dog has an old surgery where the function has changed over time and they're getting a little bit of pain and stiffness now, they don't sit normally. So what will happen is when they go to drop, they'll take weight off of, say this is the bad leg, they'll take the weight off of it and drop towards the right, transfer all the weight onto that right side as they're dropping down. The other thing they might do is they might fall quickly into a puppy sit on either side. So some dogs have a tendency to drop right onto that bad leg and tuck the leg underneath so they don't have to use it. And other dogs will drop down onto do it a little bit more subtly. They'll use the right leg or the opposite leg and then fall onto that side to take the pressure completely off that bad knee. Now the final item that you should be looking for is when the dog actually gets up. Now this is a really telltale symptom. When a dog stands up, naturally what they should do is they should just rise up. See if Bo will do it for me. Look at that. Perfect timing, Bo. Good job. So they should just pop up with the hind end. However, a dog that has a lot of stiffness in the hind end and is worried about standing up and causing more pain, instead of popping up like Bo did there, what they'll do is they'll have their front paws on the ground, and they'll throw their head forward, rock their body position forward, and instead of pushing with their back legs, they're going to do a pull-up, basically with their the front end of their body. So they're using the lats and the trap muscles, the strong back and arm muscles to pull rather than drive up. And it's very subtle, but if you look out for it, it's something that you can easily find. And when you combine all those 5 things together, if you're noticing 3 or 4 out of the 5 things happening and getting a little bit worse with your dog, you should take them to somebody to help fix them. I can tell you from my experience, I have a ton of dogs that come in with this. Now these could range from dogs that are 6, 8, 12, up to 14 even, and they have a lot of issues with the hind end and a lot of stiffness. And it's always fascinating when the owners tell me the dog is jumping back up onto things they shouldn't be. They're chasing the other dogs in the household, and it causes concern because they saw how bad they were and how stiff and painful they were, and now they're going back to being a younger dog again, and hopefully they're not putting themselves at risk by doing too much. But ultimately a dog will tell you if they don't want to do things, it's because there's a reason for that. When a dog starts doing things again, even though we don't want to encourage them to do a lot of these things to put more pressure on those joints, it's a good sign because it means the function is coming back to where it should be to allow them to do the things they want to do. I hope that helps. Don't forget to like and subscribe. We'll see you in the next video.